Lovely. Thank you, Rachel. Okay, thank you for joining me today. So my name is Priya. I'm the Community Development Officer at Papyrus. I'm going to give you a little bit of an overview about Papyrus. Hopefully some of you will have heard of us, or at least our resource Hopeline UK, which is our main resource and the way that we support young people across the UK. So if we just move to the next slide. Lovely. So that's just a picture of me. We can keep going. Okay, so obviously we are going to be talking a little bit more about suicide prevention and awareness today. You know, I don't know your experiences with suicide. You may have some personal or professional experiences with suicide. Just to make you aware of our resource, Hopeline UK. It is a helpline. It's also a web chat and a text and email service. We have all of our information on our website at Papyrus. So if you need any more information or the number or details of how to log in, please do head over to that website. But just briefly, in case you're thinking of a young person during this breakout session, or any feelings come up for you yourself, suicidal ideation or any thoughts, anything like that, just to explain how our service works. Our resource, Hopeline UK, is a helpline staffed by trained professionals. They are all mental health professionals. Most of them work in NHS or private practice as well. The suicide prevention advisors field calls from young people up to the age of 35 who might be thinking about suicide or struggling with thoughts of suicide. But we're also there for concerned others who are supporting young people or bereaved by suicide, and professionals as well. So basically, it's one service for everyone, and we are there to support people, and we especially want to support people in waves. So often we'll get a young person calling, we may well get their parent or friend calling, we may well get a professional who works with them calling. It's an anonymous service, it's fully confidential, but we are an interventionist service. So we're not a listening service, we're an interventionist service. Our focus is on suicide intervention, and if we believe that anyone has harmed themselves or might be harming themselves or others, safeguarding concerns and safeguarding processes do kick in. So you can be sure of that, because we are dealing with young people. We have to keep in mind safeguarding concerns as well. When a young person calls our service, they're taken through a verbal intervention. We use the PAL model as referenced by the ASSIST workshops. If you haven't heard of that, that's a globally recognized suicide intervention course called ASSIST, which we also do train people in at Papyrus. They go through that verbal intervention. It could be half an hour, it could be 4 hours, whatever time they need. They're taken to the point where they can create a safety plan, work on their safety, keep safe for now, and then they can think about what short-term and medium-term support they might need going on from there. Okay, lots more information about that service on our website, but just to give you a brief overview of how you can use that service should you need to ever, or pass that number on, or of course, as part of our support for young people in London and the UK, we do rely on that resource as well. Just move on to the next slide. So just to give you a brief reminder, not that you probably need one, but what we're actually dealing with. In 2018, we lost, so Rachel, if you just click forward, we lost nearly 2,000 young people aged under 35 to suicide, as decided on by coroners. So the number of suspected suicides was potentially much, much higher than this. But 12 to 18 months after we get suspected suicide data, the coroners have their say. And unfortunately, in 2018, we lost 1,866 young people to suicide. Now, within that number is 263 school-aged children, aged between 10 and 19 in full-time education. In the UK currently, if you're under 10, you're under the age of legal responsibility. So even if you do die by suicide, you're not counted towards these figures. We know there's a disconnect there because of the work that we do, and I'm sure that you've all been part of as well. But we know that primary school age children experience ideation, have suicidal behaviours, and unfortunately do make attempts and do die by suicide. So, there's some hidden data there that we can't give you, but we know that it exists. A huge, huge number. We don't have accurate data for the next couple of years because the ONS have not released that information yet. Hopefully this September we will be able to give you, and the UK will have access to the accurate data for the next few years. But it's a huge number. It's going up, the rates are going up, but we're especially seeing huge growth in 16 to 25-year-old females, which has been quite new. We know that 75% of suicides are in males, or those representing as males, but the fastest growing age group seems to be 16 to 25-year-old females. So, there's emerging demographics there, which we also need to consider. So that's just to give you a bit of background on the data. If we move on. How do we actually work as an organisation? How do we prevent suicide? So at Papyrus, we are a nationwide organisation, but we have regional offices. So our head office is based in Warrington. We were, in fact, set up in Warrington 23 years ago as a parent support group, parents who are bereaved by suicide. And that very quickly became a charity thinking about the whole of the UK, helping support young people. We have offices in Warrington, in the West Midlands, in London, in Cardiff, and we've just opened an office in Northern Ireland as well. We are then looking to move into Scotland as well. So we are trying to cover as much ground as possible in the UK. But of course, we're online, we're a telephone service as well, so we cover the whole of the UK. The way we work is in three areas. We support, so I just told you about our resource and how we support young people. I'll tell you more about our school support in a moment. We equip people, any type of people, so not just professionals, but concerned others, anyone who's interested in learning about suicide awareness, suicide prevention, and suicide intervention. We will provide them with training for those skills. There is a cost attached to training, but it's really not onerous, and you can find out about that on our website. But we do get funding from various sources to deliver. We've been working with Thrive London, which I'll tell you more about a little bit later on, who gave us a fantastic pot of money to take our sessions across London. And we're kind of emulating that in different areas, working with CCGs, NHS trusts, with local authorities, and with private companies as well, who want to kind of ensure that their local community has the access to training. And we're an influencing charity. We don't get any money specifically from the government. There's nothing ring-fenced for our organisation. Most of our money comes from fundraising, donations, legacy payments, and like I said, funding that we can access for training. But it does mean that we can kind of go back to government and say, look, we have a helpline. We support young people. This is what they're worried about. This is what's causing them anxiety. Here's why we're getting phone calls. Lots of work being done into looking at online harms at the moment. Some fantastic campaigns out there, trying to get people to understand what online harms are, what our young people are being exposed to, what social media probably needs to be a bit more responsible about. So we are working with government on things like that. All of our campaigns are on our website as well. So if you're interested in anything that we've been talking about or doing, do have a look on that on our website and have a look, and obviously contact our local offices for more information. Within obviously our organisation being a charity, of course, we have a training department. We work with community engagement in terms of working with lots of different organisations across the board, faith communities, schools, universities, colleges, workplaces, youth organisations, other partner charities, to deliver staff training and to work in the community trying to help those young people. Of course, we have a fundraising and volunteer scheme as well. If you're interested in any of those things, have a look on the website as well. But we're really interested in working with people who have lived experience, those who are bereaved, to keep them at the core of what we do, because they do influence how we work. We want to ensure that what we're doing, how we're speaking about suicide, how we're supporting young people, always harks back to those with lived experience, those who are bereaved, because they understand the issue best. Okay, just moving on. I just wanted to draw your attention to obviously COVID has had a big impact on services across the board. So just what we've found and what we've been doing, had a huge rise in contacts over the last year. So Hopeline UK, they have stats on how many people are calling, what kind of things people are calling about. Huge increases, 27% this March compared to last March. The second lockdown in October, we had a 40% increase in calls, just compared to the week before. which all mentioned lockdown and COVID. And this is young people calling our line and saying, I'm feeling potentially suicidal because of COVID or lockdown. Isolation, obviously, a huge impact on the mental health, taking them away from support systems, taking them away from treatment plans, taking them away from social clubs, school. All of these protective factors were taken away, isolating from family, friends, loved ones, support literally being cancelled, people being in the middle of treatment plans, talking to therapists, and all those things being cancelled with nothing put in place as an interim. So, we did find a huge number of contacts because of those things. Obviously, we also noticed other themes. Increase of alcohol consumption, self-medicating definitely went up. A lack of privacy, even calling our service, not having a secure room or place to call from, but we are able to offer web chat, text and email as well. So we did mitigate that there. Lack of routine for lots of people, routines are coping mechanisms, knowing where you're going every day, having that kind of understanding what's going to happen next can be really helpful if you suffer from anxiety or overwhelm. All of that taken away. Of course, furlough and job loss. We look after young people up to the age of 35. It's not just those in school. So those young people on 0-hour contracts, those young people being furloughed, not knowing when, if they could go back to their jobs. That was a huge deal for them. And of course, we expect another increase in calls in September when that furlough scheme ends. We already know we're going to have a huge number of contacts because of the financial impact of COVID, which I think hasn't been fully felt yet to our young people. So that's just to give you a little bit of background of how we've been coping over the last year and what we've been doing. So moving on. Just the next slide, please, Rachel. Thank you. So this is how we support young people and their professionals. Okay. So in terms of professionals, we provide and those people who want to learn about suicide prevention, there's 3 main courses that we provide. The first is called SPOT. It's a suicide prevention tutorial. It's what everyone needs to know. So what everyone in the community should know about suicide prevention and suicide awareness. We explore language, we talk about attitudes and beliefs around suicide. We do dip into thinking about, well, what are we looking for in terms of signs of suicide? How do we identify those young people who might be thinking about suicide? And how do we signpost effectively? So it's a 90-minute course. It's really suitable for everyone. Like I said, anyone over the age of 16 can attend that course. And it's really, really helpful often for parents, caregivers, youth workers, those working in a more voluntary capacity or supporting young people, maybe not in a professional capacity. So really suitable for, when we look at a whole school approach, often we'll say, make sure that maybe your admin staff come to this session, or teachers that don't have a pastoral element to their role, anyone really that wants to learn from scratch about suicide prevention. So just moving on. And then we've got there at the bottom as well, Speak as well. Speak is our half-day course, which is aimed more at professionals, but again, anyone can join that course. We really learn some skills there about how to have conversations around suicide. We delve more into the signs. We also talk a lot about safety planning and documents and processes that you might have in workplaces, schools, colleges, universities. So that is more of a skills-based session, definitely more aimed at professionals. But again, like I said, anyone can take that course, especially if you are currently supporting a young person, you want to know more about how to have those safe and sensitive conversations. And the next slide just shows you a little bit of information about Assist. We're not the only provider of Assist in the UK. There are many providers of Assist. It's a globally recognised suicide intervention skills training. We do deliver that training. It's a 2-day course, and we do suggest that at least 1 or 2 people in every organisation, whatever it might be, have that training. Just as you would have a mental health first aider, or a couple of those, then having these people as well in your workplace to know what to do if someone needs verbal intervention for a suicide. We absolutely support schools and colleges both in prevention and postvention. So if you want to refer a school to us, you can absolutely do that. We will take them through how to train their staff, what training their staffs need for a whole school approach. We can take them through our guides. We can get them thinking about documents and processes, suicide safety policies, and we'll absolutely work with schools on a one-to-one basis. So, we do offer that. We also offer post-vention support, just like Samaritans do, bereavement support as well. If you're worried about a cluster of schools, or you've noticed that there's some things going on in a specific school, they need more support, absolutely refer them on to us and we can do that. Okay, so just moving on. This is just to give you a little bit of information about the Thrive London project you may have heard of. We were given some funding by Thrive London about 2 years ago now. COVID got in the way and increased our deadline, but we've been able to train almost 1,000 educators across London, in every borough of London, with suicide prevention skills. We're going to moving on now to teaching and also training a number of people in every borough assist as well. So, we've had fantastic uptake of those courses. Because of COVID, we moved completely 100% online, and we had even more take up. This is just a very fraction of the outcomes we've had from people. We're going to be following up with people in 4 months and 6 months as well, to see the impact that it's actually had on their schools, on their whole school approaches. And absolutely, they can come back to us and get more training and support at any time. Those contacts will be for as long as they want them to be. So we've had some fantastic sessions, and like I said, schools have come back to us for further support and training. So just to give you a little bit of background of what we've been doing over the last couple of years. So just moving on, only a couple of slides left now. Basically, room for questions now. I know that we're in a breakout session, so please do feel free. I think, Rachel, we can come out of the slides now. That's fine. There we are. So just in terms of comments, questions, thoughts, who'd like to start us off? Ali. Sorry, I'm muted, Ali, sorry.
Sorry. Thank you for that. I just wondered, how much does it cost, to have this? Because it sounds like we should really get this, because we have mental health training, but
absolutely. So it's £250 for the 90-minute session for up to 30, £450 for the half day, and then the assist course is £165 per person. All of our prices are on the website, and you can obviously email me as well. But they are really, we haven't increased our prices for years.
What's the majority of people that you could train at once on Zoom?
30 people.
30.
We have 30, whether it's face-to-face or online, because they're very interactive sessions.
Yeah, okay.
And it's to ensure that everyone has got that chance of practicing and talking and discussing. So it's 30. But whole school approach, we'd train the 30 pastoral team, and then they would then disseminate as they wish.
Oh, okay, right. So we've got 200 schools, so we would basically
then so you could do a whole day session where you have a couple of sessions, send 1 or 2 people from each school. Not all schools take up the offer, so it's a bit of give and take. And obviously we do run open sessions throughout the year as well, so other people can sort of join on.
Well, obviously we've had some pretty horrific cases, so yeah, I'd be really interested in taking this up. Thank you.
Absolutely. No, do contact us. You'll have all our details after this session as well, so do contact us. Thank you, Anne. Any other thoughts and comments?
What's the figure? What's the figure for suicides in post-pandemic then?
We don't actually have that data yet, because it has to come from the ONS. It has to come from coroners.
So 2018 is the most recent figure,
yes,
is it?
For the UK. If you go to the ONS website, they have data for England and Wales for 2019. But as we're a nationwide charity, we want to give everyone the full picture.
Have you seen the Millennium study? It says that 1 in 7.
No, I haven't seen that yet, but I will have
basically,
a look at that.
I think the stat is 1 in 7. Right. They tracked a load of millennials
Yeah.
And basically 1 in 7 have tried to commit suicide.
That's a huge number, isn't it?
Yeah.
Yeah, a huge number. Thank you, Ali. I'll look into that. Elsa. I think we're moving back to the main meeting, so hopefully I can take some questions in that session as well.